There we go. All right. Well, it's 9:01. We can begin. Dallas, are you
Sure.
good to go?
Good to go.
Certainly. Okay. Well, hi everybody. I'm Sherry Somerville. I'm the CEO of the Atlantic Chamber of Commerce, and I'm glad we could be here today together. Last week, when we were talking with the chambers all over Atlantic Canada, there was a noticeable shift from businesses from where do I get support to let's start thinking about how do I reopen and how do I set up my business, my particular business, to be able to navigate the changes that COVID have presented. And so I was introduced by our St. John's Chamber colleagues to Dallas Mercer, who has been navigating and helping businesses become safer for the last 18 years. She runs Dallas Mercer Consulting. I know she has done presentations all throughout COVID, helping essential service providers, and continues to do presentations and help businesses in her spare time here when she's not making presentations. So you must work 24/7, Dallas, these days.
No, I'm definitely working harder than I've ever worked, for sure.
Well, thank you so much for being here. I will give the floor to you because I know we've got 1 hour, and I think we were going to do the presentation and then open up the floor. We've got a small group, so open up the floor for questions.
Yeah, the presentation is about 20, 25 minutes or so, and
Okay.
then, just to allow people to ask some questions. So thanks, and thanks for joining. So I guess DMC clients quickly turned to us for guidance to stay open, or to reopen as it is now, especially our essential clients. So DMC's history is in managing sick and injured workers for employers to get them back to work quickly and safely. And then we also have an occupational health and safety division with occupational health and safety consultants. And we also have a team of occupational health nursing, and we have an industrial hygiene department. So when this happened, clients quickly started turning to us for guidance and help. And for the first, little bit, we were kind of like, in a bit of a daze. And then we quickly assembled our teams to actually cross over each other to figure out what we could do for our clients. So we're actually going into our clients' work sites. Either we're walking in or we're doing it virtually because we're doing a lot of work for different companies in Nova Scotia and New Brunswick. And we're doing risk assessments and providing evaluations for them, and then providing guidance on what they need to do. So we're actually writing their plans for them and helping them figure out what they need to be safe or to keep their customers safe. So it kind of, happened over the first few days. It seems like a lifetime now, even though it's only been about 8 weeks that we've been doing this. So after the first few weeks of really helping our clients, then we decided to put together a little presentation for companies so that we could help them. There's a lot of data out there. There's a lot of stuff coming at you as to what you should be doing to keep your employees safe and your customers safe. So I guess we thought it might be valuable for us to present a little roadmap for companies so that we can take some of the mystery away and help companies move through this as different governments move through what you're allowed to do from a provincial perspective. So what we know about COVID. So COVID, there's health hazards. What do we know about the symptoms and the transmission? So the epidemiology of the disease, how it spreads, who are high risk, the elderly, the immune compromised, and as well people who have underlying chronic conditions. 80% of people have mild symptoms who experience COVID, but importantly, asymptomatic people can still transmit the disease. So that's very important for us when we're thinking about what we need to do from an employer perspective and a company perspective. We know that it's transmitted through droplets and contact. It can contaminate surfaces and objects, and it can survive for hours to days on surfaces. And in the early days, it can be transmitted prior, as I said, to somebody having symptoms. So we had to take what we know and then think about our workplace and the characteristics of our workers as well. So employer responsibilities. I mean, employers have an obligation to take every reasonable precaution to ensure the health and safety of our employees. We need to ensure our employees understand what their role and responsibility is as well to remain safe. So what I'm going to walk through is, providing a safe workplace, a mitigation plan. So what do you need to do to mitigate this particular risk, which is COVID? A communication orientation plan. So how are you going to communicate this to your employees, your customers, or how are you going to orient your staff to feel safe to come back? Monitoring and updating with new information, making sure we follow the protocols, and what happens when there's a positive test. So what does a safe workplace look like? So you need to think about your workplace in a totally different perspective than you currently think about it. So what we've done for our clients is we've had our occupational nursing side, which is the health side, and we've had our safety engineers who are used to doing hazard assessments and going into a workplace, and we've had to turn our attention to a different kind of hazard, which is COVID-19. So you need to walk through your workplace with a different lens. So you need to look at your workplace from the perspective of your employees. So what do your employees need, and what do you need to do to stay safe? What are your customers going to need to stay safe? So that's a different lens than your employees. So what's going to make your customers feel safe? And then you need to look at it from the health perspective and then the safety and risk perspective. So you also need to consider what Health Canada, and there's lots of information on the Health Canada website for protocols in different kinds of workplaces. So it's always valuable to take a look at that kind of literature as well, which is readily available now to access. So then you need to look at your mitigation or your exposure control plan. So you need to go through that organization and then go through your company, the building, spaces, and then figure out how to assess the hazards that you've identified. So the plan is mandatory in most provinces. So no matter where you live, you need to have a plan in place. In some jurisdictions, you actually need to present the plan. In some jurisdictions, you need to have it in case somebody needs to see it. So you need to mitigate each individual hazard. So you need to think about your staff, how they interact. You need to think about the demographic of your staff and whether or not they have any predisposition to COVID. You need to think about the people that they interact with and how much interaction there is, and is it face-to-face contact, and how close do they get? And the demographic of your customers as well. You need to think about common areas. Where do people typically gather within your organization? And what can you do in those places? In some of our clients have actually closed a lot of those areas off. In the lunchrooms, in some cases, we've taken half the chairs out of the room, and we put X's on where we want people to sit. So, because we're all looking for cues. So, different kinds of things that you might need to do with common areas. The entrance, how do people enter the building? Do they have to physically open a door, or do they, can they have automatic entry? And how many people congregate there at the same time? Can people maintain the physical distance of 6 feet? And if not, can you reconfigure your organization so that they can maintain a 6 feet distance? Do you have contractors coming on your work site? Do you have people who bring deliveries to your work site? And what kind of processes can you put in place for those? Because having a process for your employees and then the delivery guy walks in with things might throw things off. So you need to think about that in advance. Can you maintain the quality of your work or your product? So can you put controls in place and still maintain the quality of the work that you're doing? How do customers interact, and how do customers, if you do have customers, how do they enter your facility? If you have smoking, do you have a smoke room? And a lot of our clients have actually closed it off, and if people want to smoke, they have to go in their cars or whatever the case might be, just because in some areas where they have smoking areas, it's really challenging to maintain the 6 foot distance. You also need to think about, the hand sanitizer and smoking, and warning people that, if you're using a lot of hand sanitizer and you light a match or a cigarette, you could actually have some burn issues. High touch services. So you need to think about the doorknobs and the light switches, and can you leave doors open, and how much touching is there going on and who's going to be responsible for the cleaning. Mail. We've actually put protocols in place for mail for some of our clients because people were nervous about touching the mail. And in Newfoundland and Labrador, there were some positive COVID cases with people who worked at Canada Post. So there was a lot of questions about how to handle mail in the first little while. Elevators. So does your company have elevators? Is it a shared elevator where other people in the organization, in the building, are using the elevator, or are you responsible for the elevator? Who's going to be doing the cleaning in there? Are there shared tools? Is there money handling? What are you going to do about the washrooms and how many people can go into a washroom? So you need to break down your business into all of those pieces and then systematically take each individual risk that you identify and figure out what the plan is to mitigate that particular risk. So then you need to think about, okay, what are the kinds of things that we can do? So can we pre-screen people coming in? For example, at my office, everybody gets their temperature taken before they can enter the office space. Are you going to do questionnaires? Are you going to do questionnaires daily? Are you going to do questionnaires weekly? And how's that going to look? Are they going to have physical paper? Are they going to send them in? Are you going to do it digitally? So how's that look as part of the pre-screening? Are you going to use personal protective equipment, PPE? And do you need PPE? And those are things you need to evaluate. You know, and I've been recommending to companies, don't go out spending a lot of money if you're not sure if you even need to have personal protective equipment. And if you are going to have personal protective equipment, you need to make sure you train people in how to don and doff the equipment, because you can have just as much hazard or risk in not being able to dispose of the personal protective equipment properly. So you need to make sure that if you are going to have it, that there's actually procedures for safe storage and handling. What kind of cleansers and sanitizers are you going to use, and where are you going to place them? They need to have a certain percentage of alcohol. So you need to check with Health Canada with the DIN number of your sanitizers to make sure that the sanitizer you're using actually is appropriate for fighting COVID-19. Cleaning and disinfecting. So how do you normally do your cleaning in your office right now? And they're recommending that you should do rigorous cleaning and you should increase the frequency of your cleaning. So whether that's with an outside company or whether you're doing it yourself, you need to have conversations around that. And how does that look? And are you going to be cleaning more areas than you're used to cleaning because of the common touch surfaces that have been identified as hazardous? And when you've done your walkthrough, you should make sure that you've identified what needs to be cleaned. Do you have hand washing stations? And as we know, hand washing is the #1 thing we need to do to combat COVID-19. So do you readily have warm water and soap available for your employees? And of course, lined garbage bags to make sure that no one actually touches the garbage. Are you able to maintain physical distancing? Do you have to move workstations? Do people have cubicles? Do people have offices? So how can you maintain the 6-foot distancing? Can you engineer the hazard out? So can you isolate people by putting plexiglass? And you'll notice in grocery stores now there's a lot of plexiglass. And some of our manufacturing clients have actually installed plexiglass on lines on wheels, so that people who work on the line in a factory have plexiglass in between each worker. So is that something that you're considering? And if you are considering that, then how do you begin to start that? Signage is critical. So I know all of us right now, when we walk into a place, a grocery store or a drugstore, we're all looking for the signs as to where we can stand, or where's the sign to tell me what I got to do? So we're all looking for signage now. So you really need to be ahead of the game and making sure that you've got your hazard assessment done, so that you can start to look for that signage and appropriate signage. Your customers are looking for it and your employees are looking for it. Just reminders on how to wash your hands, etiquette for sneezing and coughing, and these kinds of things are really valuable right now. So signage is pretty critical. How many people are you going to have within your workplace? Do you need to reduce the number of people you have and have them coming in different days, or are you still going to be able to have some people work from home and some people in the office? Are you going to stagger arrival times? So, figuring out the logistics of how that will look, or do you need to make logistical changes within your organization to keep people safe? Are you going to purchase foggers or rent them? And those are the machines that can sanitize an area when you're not there. So a lot of factories and food processing places are using foggers. What are you going to do about travel? Right now, of course, there's no international travel, and a lot of smaller places, just not a lot of travel either. But what kind of company policy are you going to have about travel? And if you have to travel, what kind of protocols are you going to put in place for your employees who are traveling? Are you going to log customers coming in and coming out if you're able to do that? Some organizations are not. And as well with employees. And money handling, are you going to have people pay in advance depending on what they're purchasing? Or are you going to, put a process in place if people do have to handle actual paper money, and and how people are going to sanitize if indeed they do have to handle paper money? So once you've kind of, done that evaluation and figured out what kind of things you need to put in place, then you need to think about your communication plan. So the communication plan is critical for easing people's anxiety and their mental health. There's so many rumors, there's so much misinformation. So your communication plan, once you've done the other steps, you need to think about your employees, think about your customers, how they take in information, what the best way to do it, whether or not it needs to be over Zoom. For some of the processing facilities, fish processing, we actually did them in person. We went to facilities, we brought workers in, kept them social distance in the lunchroom, because they needed that reassurance to know what the organization was doing. So you need to think about your own employees and how best they will understand the processes that you're putting in place. So there's a lot of misinformation. It has a huge impact how people understand what you're doing as an employer, and it will affect the mental health. And you need to be mindful that everybody is going through this pandemic in a different way. And for some people, it could be triggering other things that they've gone through in life. So you need to be, empathy needs to be on bust right now, and you need to be very mindful of what people are going through. So understand your own staff, understand your own customers in figuring out how to go through it. I highly recommend that you put a written plan in place, so that even though you might decide to, do it over Zoom or do it over some other kind of communication with having meetings with people, I think you need to also have a written plan that people can refer to. It adds a very high level of comfort for people. So that whole orientation and bringing people back or allowing customers in, needs to be very open. And two-way communication is really important. If people have ideas to share with you, then you should listen. They could be really good ideas, or you might need to explain why you can't do what is being recommended. But I think it's vital for people to feel like they can communicate with you. And of course, a high degree of common sense is really valuable right now, and it's pretty much imperative to be opening. As each province moves through different phases of the reopening, you need to remember that workers have a right to refuse unsafe work. So if workers feel that it's unsafe, they do have a right to refuse, and then you have an obligation to work through that with the various occupational health and safety divisions in the government. They may determine that what you have is safe, and they'll explain that to the worker, or they may determine that you need to take some extra steps. So we've seen that go on a lot in the last 8 weeks, where unions have been involved, or employees have called occupational health and safety stating that they're not going to work because they don't feel safe. So I think right now there's a high degree of that feeling. So the more you can communicate, and the more that you can demonstrate to your employees that you have taken the necessary steps and thoughtful approach to keeping them safe, can be valuable on the other side, because you don't want to go through a process and then have to be shut down for a couple of days. So, because you had to put extra things in place. So it's important to be mindful of that. So with regards to updates, you need to monitor. This is an evolving process. We were just doing a risk assessment for a golf course to open, and by the time we did the risk assessment to when we were putting the protocols in place and writing the mitigation report, the rules had changed. So it's important to stay up to date and make sure you're following what's going on in your particular province, and be prepared to make changes. So keep everything as current as you can. When we're doing these risk assessments and these mitigation plans, we're giving them to everybody in a Word document, because we know that it's an evolving process. So you need to make sure that you allow for changes. So have regular updates as you need to, but don't relax any of your processes unless you communicate that they're going to be relaxed. So even though it might change within the province, because we're all learning as we're going during this, the governments are learning too. There's no rule book for this, so we're writing it while we're doing it. So I think that, if you're going to relax rules based on something that changed, make sure you give your employees an opportunity to understand that, we're going to make a change. You might need to wait a day or whatever the case might be, but it is important not to relax things unless you've communicated that. So follow the protocols and process. And that means everybody in the organization is following the protocols and process. Your employees are going to be watching, your customers are going to be watching what's happening. So if you have protocols and process in place, everybody must follow them, no exceptions. So the CEO or the owners, they don't have a different set of rules. From a comfort perspective and everybody feeling less anxious, it's, I think that it's integral that everybody follows what the protocols are. Again, as I said, re-communicate as changes occur. Know when to have your employees call 811. It's also valuable in your mitigation plan to explain these terms, that we're all using these new terms, self-isolate and self-distance and quarantine. I think that employees, you may assume that they understand what all the definitions of these are, but they may not really understand the definition, or they may have a preconceived notion of what these words mean. So taking the time to explain in your plan the definition of these words, is crucial for your employees, really, from a comfort perspective as well. I mean, some people might not want to ask what these terms mean, so you can easily find these terms defined. Ahead of time, you should think through what are you going to do if a customer or a worker doesn't follow what the protocols are. So, and your reaction time to this will be very important to your employees, and your other customers will be watching. And we did have cases of this over the last few weeks where we had an employee who said, I'm not doing this. This is stupid, and we had to act immediately and have a protocol in place. In this particular case, the employee was suspended until they redid the orientation and understood what the risks were to them and to their coworkers. So you also need to have a plan in place for a customer who's not going to follow the protocols. And how much work you put into this up front, then there'll be so much less of a headache as when it happens, because you've already thought through what the protocol is going to be and you've communicated that protocol. So customers know if they don't follow your protocols, they're going to be asked to leave. And as well, employees who don't follow the protocols, the same thing will happen. If you are a company who's going to be using personal protective equipment, then you should have a protocol and procedure in place for donning, doffing, putting it on, taking it off, and make sure you communicate that procedure to your employees. You just don't hand out masks or whatever the case might be, gowns, if you're not going to go through that protocol with explaining to people, because people get very nervous about that. So, up front, you should have that protocol already developed and go through the training. So we've been really busy over the last few weeks putting those protocols in place for companies. And then very quickly, we also needed to realize that we needed to have a response plan for a positive test or an employee whose relative or someone in their household is going to be tested. So have that communication plan. Just assume you're going to have a positive test. So if you assume you're going to have a positive test, plan for it ahead of time so that there's not a big scramble and panic if you get that phone call, because we already went through that. We went through that panic because we were busy getting things going. And then, so now we've gone back with all those organizations and put protocols in place for a positive test. So have a communication plan with your employees and with the customers. If you're going to be involved in contact tracing, obviously public health is doing that, but they rely a lot on the employer or the employee to provide them information. So have a plan for that. You'll have to follow public health instructions as to whether or not you have to close down and do a deep clean, or whether or not you can continue working and you might need to do some sanitizing. So public health will guide you through that. You also need to be mindful of people's personal information. This is still an illness. And while everybody's talking about it, we do need to be mindful that people still have a right to their privacy. I know we're doing a lot of things that we wouldn't normally be doing, like taking people's temperatures and health questionnaires before they come to work, but we still need to be cautious that it is people's health. And there's some stigma around it. So just be careful and cautious about who's doing that communicating. So what we have recommended with our clients is assigning a response team in advance. So having roles assigned to people in advance, then you're not scrambling or you're not repeating different things. So have a team lead, have someone who's involved with the contact tracing, who's talking to public health and providing as best they can, what possible customers the person may have come in contact with, or other employees, or it may actually be a customer. So then you might have to figure out, who served that customer or who was involved. If there's a local agency that you need to communicate with, whether that's food or some other agency that you're responsive to, then you may need to notify them. Have someone who is the public health liaison, so have someone in the organization who does that actual communication with public health. Have someone who's looking after the communication. So, think about who in the company is appropriate to talk to the person who is affected. So if it is one of your employees and you need to have a conversation with them, you might even want to pre-script some questions that you're going to ask them, and you need to be mindful that they're under a lot of pressure too, and they could have a lot of things going on because they're also thinking about other family members that they may have infected. So be mindful of who is assigned that, whether or not there's other staff who need to be notified or involved, and do you need to have a communication with customers or the public, and how's that communication going to look, and who's going to be responsible for doing that. Have a sanitation company in your Rolodex, so that if you are an organization who you predict might need to have a deep clean, or you might need to have a rigorous cleaning to make employees feel safe to come back, who are you going to call that is capable of doing that? And who is going to be gathering information like floor plans or the employee's workstation, and depending on the size of the company, it might be one person who's handling all of this, but it's good to have a list of all the things that you're going to need to do in advance, rather than having that panic. Like I said, assume you're going to have a positive case. We're going to be living with this for a really long time, so the chances are high that you're going to have a positive case, or someone close to someone is going to have a positive case. So how are you going to handle that? If you think through that in advance, you avoid a lot of the anxiety when it happens. All right, so I've walked through that in about a half an hour. So I'm able to take some questions if you have any.
Alice, it's so interesting when you think about it. Every little space, you go through your days and you don't really notice much, and then you really have to look at every little, common surfaces. If you have a common fridge, the washrooms,
the fridges are closed. Fridges are normally closed at our client sites. We've shut the fridges down. But you're right. Until you do that walkthrough with that lens, it's hard to think it through.
Yeah, absolutely.
And we've gone into companies who've had their protocols already put in place, and they did a really good job with the information they had. But once we walked through and identified all the other things, they were shocked that they hadn't really seen that, because it's your own workspace, and it's hard to have that different lens when it's the space you're in every day and you don't really think all that through.
No, absolutely. I actually just with a massage therapist had rebooked an appointment there for the end of May, and she sent me, because she just opened her business in her home, and has sent me an explicit list of stuff that I have to do before I can set foot in there. So
good. I'm happy to hear that. That's fantastic.
Yeah. So I was ordering a mask very quickly.
Yeah, it's good.
And if there are any questions, you can certainly type them in the chat. I can see all of them there, if there are any.
And if you have any questions for me afterwards, you can certainly reach out to Sam, and she can set up a call, and I'm happy to answer any questions that you have offline if you don't want to ask them online.
So the types of businesses that you've done, of course, there's the essential services right now, but what other types of businesses have you laid out so far?
Oh my gosh, it's been everything from factory freezer trawlers to fish processing, to golf courses, to hair salons, office spaces, accounting firms. It's really everything. I mean, it's pretty amazing that, people are anxious and don't really know how to do this. So, I think that having a little bit of help right now is really important. And a lot of governments are providing funding for us to help the companies. So I know
That's
they
good
are
to
in
know too.
PEI as well. So that helps alleviate that, but also, employees feel good having us involved. So yeah, we've been involved in a lot of refrigeration companies. It's endless. And it's interesting because some of them are companies we've never been in. So, we're not, we're walking in and, it for our clients in the first few weeks, we knew them anyway. So it was kind of the evolution of this for us has been really interesting because we worked first in all of our clients, and a lot of it was food processing. So, we were already familiar. So it's kind of a good training ground for us from a familiarity perspective to have gone through it in that way. So, yeah.
I was wondering about any suggestions about bringing in student staff for the summer. Are there any particular recommendations in that case?
No, I mean, I'm going to be bringing in students, I hope. So you just need to go through the orientation. I think you might need to take a little bit of extra time. Depending on that particular student, they may need to be, oriented in a different way, depending on what type of work you do. But no, I don't have any concerns. I mean, as long as you go through the processes and everybody follows the protocols. This is a good thing. Students need to learn this. I mean, this is a good experience for students to go through.
This came up the other day, actually. I forgot about this one. If there are multiple businesses in the same building and have a separate office spaces but share a common entrance, washroom facility, how can you develop a business plan for that?
Yeah, well, I mean, so I have my own DMC for our office in New Brunswick. And I actually reached out to the owner of the building we are in today to find out whether or not he's putting protocols in place. So whether or not my employees return there will be highly dependent on the protocols that he's putting in place in that building, or whether or not he has expectations that we're going to manage it ourselves, which would be a challenge because we'd all have to walk around with disinfectant for the elevators and the bathrooms. So I think you need to have a conversation with the property owner and make sure that you walk through what your protocols are going to be and see whether or not they are in line with yours. But and that's dependent on what your responsibility is and how many people are going to be using that particular washroom, and whether or not they're going to have a rule that there's only one person in the washroom and can people maintain 6 feet. But under normal circumstances, we're recommending one person in a washroom just because people get panicked. You have a sign as to whether or not there's someone in there, and that you sanitize on the way in and you sanitize on the way out. So outside of a washroom, there should be a little table with sanitizer, because in order to get out of the washroom, a lot of times you have to touch the handle. So there should be strict protocols in the building. So I would recommend you talk to the owner of the building and just find out because they need time to prepare. I reached out to mine this morning because I'm sure it's going to, if he hasn't already done it, it's going to take a couple of weeks to think that through and how that looks.
And if a property owner isn't doing anything, what does a business owner, like if yours wasn't doing anything and just going, oh yeah, no, everything's okay. What would you do? Do you call the 811 number or occupational health and safety?
Well, I can't imagine that because they'd have to be living under a rock and you're paying rent. So if these are the rules right now for common spaces, then they have to follow the rules too. It might take them a little bit of time to figure it out. So you give everybody a little bit of grace right now. Because I do think that it's a whole new normal, but they'd have to be, really not living on Earth to have figured out that it's a different place right now.
Yeah.
So they have an obligation to provide a safe space, and it's being mandated and it's being policed. So it's really no option if they want their rent money.
If they want their rent money, this is true. And then personal protective equipment. I know some of our chambers are actually starting to put together lists of those companies that are starting to produce it and provide it, like hand sanitizer is a common one. We get emails every day. I actually just got an email 2 days ago with one of the printing companies that has signage. So we're trying to put all those lists on places. Yourself, do you provide lists of places or places to go get the equipment?
No, no, I mean, I do have sources. We've always had sources for personal protective equipment, so I still have those. So, for the companies, where I can, I'm helping companies source some of that. But I mean, there's lots of lists in different provinces for people who are providing that equipment. Companies just need to be really careful about buying a lot of stuff, you know, without doing that assessment to see if you really need it. Because we're in this for a really long time. And if you're going to be spending a lot of money on personal protective equipment, make sure you need it.
From Alvin, what type of procedures do you have in place to go to a work site to do safety training or risk assessments?
We're doing a lot of them virtually, but we are going to site. If we go to site, we'll wear PPE. So, but we're doing a lot of them virtually now. The client is doing a video. The company is doing a video, and they're sending us the video, which is working out really well. We actually, you know, helped in a lot of companies virtually. So they send us a video, and we analyze the video and do the risk assessment. We might need to go back and ask a few questions about what was in the video, or to get a different view of something else. But video has worked really well for us. So, but if you're going to go in to do the assessment and the company is going to be there, then we will wear PPE.
Sorry, I was messaging back and forth here with Jacqueline. I think I know what she's asking. Do you have any recommendations about ensuring protocols? I think that's what she's asking.
You mean when you do the orientation and signage and those kinds of things to ensure that people are following?
Enforcing protocols, Tracy is saying. Yeah.
Okay, so I mean, you need to have lots of signage, and you need to communicate it. So you can't have a protocol and not tell anybody what it is. So, you know, right now people are looking for reassurance. I know when I go to the grocery store, I'm looking for where to stand. I'm looking for that person to greet me when I walk in, tell me the cart's already cleaned, or if I got to clean it myself, or, you know, not to leave my cart. Like, so over communicating right now is a good thing. And you just need to be very clear that as well, communicating if people are not following the rules. And however that looks to you from a disciplinary perspective, whether it's they will have to leave, they'll be suspended, they won't be allowed back for 2 days, or whatever the case might be, you need to communicate that up front.
I'm the sole employee in my office, but if a customer walks in, do we need to have plexiglass up? There's lots of physical distancing space.
So if you can physical distance, that's the number one thing. If you can do that, then you don't need anything else. If you can maintain 6 feet, then you're good. But if there's a risk, then you need to think about other things.
Excellent. I'm not seeing, is anybody else? Are there any other questions?
And again, if anyone wants to reach out, it's no problem.
We'll post this in our member resources section so that the chambers can get access to it and share it with their members, the recording. Is there a policy for face masks for customers and staff?
It depends on whether or not you can maintain the 6 foot distancing, and it's different in every province. So you need to check with your own occupational health. Right now, my understanding is if you cannot maintain the 6 foot distance, then PPE is required. And that could be glasses, goggles, face shields, and masks, depending on what industry you're in, or whether or not you need to think it through, because sometimes the PPE can actually cause another hazard, like if your glasses are fogging up and those kinds of things. So you just need to think it all through and understand your own business.
Yeah, because something as simple as a customer going to pay for something, you know, grabbing the point of service, the machine, the merchant machine, they'll step closer, right? They might not be able to continually maintain that 6 foot distance for the whole.
Well, that's where we're seeing a lot of plexiglass.
Yeah.
Or we're seeing that the machine is now moved out to a table, so it's further away from the person, and it's moved out to a little table on the side. So you just need to think outside what you normally do. And I mean, employers have been incredibly creative in what we've been able to come up with. It's been fascinating.
I saw one restaurant picture where they put up shower curtains in between each table. Plastic shower curtains. So.
Yeah, I've seen some interesting things being posted, and of course we're researching all over the world what's happening.
Yeah.
so that we can have options for our clients. And, you know, we're looking at what are they doing in hair salons in Germany. So, you know, it's fascinating to see what different organizations in different countries and different companies are doing.
Julia has a member that runs a cottage business, and he was concerned about how to communicate to customers what his cleaning product policy is. What do you recommend is the best way to relay this information? A written list provided in each cottage?
Absolutely, yeah. And you can even have it on your website. So, you know, so that people can access it ahead of time. And we've done some work in the hotel business in the last few weeks. And so what we've been doing is what they had been doing was leaving the rooms for a couple of days. And if you can do that, that's great. Before they clean the room, they're leaving it for a couple of days so that, you know, the virus is likely dead if it's in there before they even clean it. And then they're doing the cleanings and communicating to the customers exactly what protocols they're using and what process they're using and what cleansers they're using.
Okay.
Over communication.
On every channel that you can possibly do it.
Every channel. People want to know. At least right now. That could change.
Yeah. Well, I think there's we talk about this quite a lot, consumer confidence. Right out of the gate, that is the biggest challenge. We can open, you know, I'm here in New Brunswick, and you can open stuff up, and people are still a little bit, some people didn't go out, and people are still a little bit wary when they do go out, you know. How
Yeah,
to
well, you need to be
act.
prepared for that. You need to be prepared that you put all the protocols in place and people may not come. And it might take baby steps because, you know, we're all scared.
Yeah. It's empathy is a key thing right now, for sure.
Needs to be on bust.
Yeah. All right. I'm not seeing any other questions. Are there any more? That's why everyone wants to live on PEI. There you go, Julia. That's exactly it. Go to PEI.
That's right. PEI. Oh my God, they're the rock stars of all this.
Yeah, I agree. Excellent. All right. Well, I don't think we've got any more questions there, Dallas.
Thank you so much.
We will share this, save this, and share this with the chamber so people can watch it that couldn't make it with us this morning. And thank you so much for your time, your knowledge, your expertise, and for spending it with us this morning.
Well, thanks for having me. I really appreciate it.
Thank you. Oh, lots of thanks in the chat room there, so that's great.
Okay, thanks.
Awesome. Thank you, everybody.
Okay. Bye, guys. Bye, Sherry.
Bye.